Hi, good evening to everyone. Thank you for joining me. I'm Dr. Philip McMillan, and I continue to keep you updated about interesting and challenging bits of science that are inconvenient for those who have a mainstream narrative. I ask difficult questions and I bring to your attention very strange patterns that are occurring across the world. One of them is the fact that I really have to wonder if there was ever really a priority on saving people's lives. There's a reason why I've said that, and it's because I'll be talking about an international COVID expert whose name I cannot mention. It's very important to understand that his name actually triggers the algorithm to suppress the content. Why would that be? Because this person has done remarkable work across the world and is now being challenged by the health authority in his country to take away his license. I can't say his name. For those who are well aware of the research and the work that I've done, I have spoken to him many times. He's a very important voice, and people are trying to silence him for saving lives. It really is remarkable. I cannot explain it. I don't understand why this would be happening. So let's take you back to what is happening now, and then I'm going to take you through a journey of something very unique that he did that very few people know about. Before I start, just a reminder for everyone, just in the description below are the links for Are You Prepared? Disease X. I've mentioned before that this, in effect, is not actually going to be a new disease. It is going to be the same disease rebranded. You need to understand what is happening, and critically, you need to look at the options that are available. Additionally, coming up in another few days is I'm speaking about my Advanced 360. This is a really important foundation to understanding what is happening with regards to the COVID pandemic. There's some very unusual characteristics about this virus. And if you're not aware of what impact it has on different organ systems and so on, it's very difficult to understand some of the very strange patterns that we are seeing and are going to see. So if you're interested, please click on the link below. So let's get back to the question. Was the priority ever about saving lives? Now, as I said, this unnamed international COVID expert went about observing the pandemic early on. He found certain patterns, what he calls the eighth day. For those who know who he is, will know exactly what I'm talking about. And he saved the lives of all of his patients in a semi rural community in a southern part of Africa. You would think he'd be celebrated for it. No, the health authorities are saying, what were you doing? You should never have gone off protocol. You should have let the patients die. Because remember, there was no early treatment. He didn't have access to a hospital. So, in effect, they were saying, by you doing something and saving lives, that's wrong. You got to call it as it is. There's no other way to describe this. Now, I'm going to take you on a very critical journey for you to understand. Now, before I do, this is the Twitter or tweet that was made by Steve Kirsch when he's highlighted what is happening. That his colleague, and the name is here that I can't say because the algorithm will pick it up and suppress the content. He's put on trial on the 6th of April. Okay. That is just a few days ago because of his views and the treatment. So the reality is that there are some people who say that you cannot do anything outside of the protocol. Even when you don't have a protocol, it is better for you to do nothing than to try and do something. If that's the style and the practice of medicine that we are at the moment, I don't agree. I don't want to be part of that. You must always do everything in your power to protect the health of your patients. So, this particular doctor that remains unnamed did a very unique piece of work in a specific part of the world. And so, I'm going to show you a map of the world so that you understand what I'm talking about. Here you have a map of the world. And after I had done an interview with him in April 2021, here you can see India, here you can see China, down here you can see Bangladesh, and there is a region here that is part of India but is autonomous. This region here, Meghalaya, I don't know if I've pronounced that correctly, but it is a semi autonomous region of India that has its own government and administration and it operates on its own. And so, what happened was that in April 2021, that was when I had the first interview with him. They reached out to him because they were having the surge of the Delta wave, and this was causing significant deaths. That region has a population of about 3 million, and it's very semi rural, widely dispersed communities. So it needed unique strategies to be able to help its people. There may have been difficulties with getting people into hospital, and this is highlighted in the context of what I'm going to share. So it was an important time for them. And just so that you understand the numbers, I have got here the pandemic region information for that region from Wikipedia. I've downloaded it because I suspect right after I've finished this, people are going to want to hide this information because it is so significant. So watch this carefully. This is the timeline. In 2020, they had one death, May 2020. And it's rolling along. They had one death there. This is July 2020. They had four deaths at this point here, rolling down. August 2020, keep going there, all the cases, all the deaths, September 2020. I'm rolling down. I'm taking you somewhere. So just hang fire as we come into January and February. Now, at this point, they had 146 deaths in January of 2021. And you can see in February, it was 148. Rolling down into March and April, March is 150, relatively stable. April, 151. But then we had the Delta surge. The Delta surge set off in India, and so of course it would have an impact on this region. So by May 2021, they had shifted from 151 to 524. By June, this was 762. By July, it was 918. And by August, it was 1,299. This is significant numbers. And for people who are genuinely interested in health, they needed answers. They needed to find a solution for what was going on. And this is what they did that was very interesting. They then reached out to this specific international COVID expert because he had just been talking about how many lives he'd saved in semi-rural part of Africa. So their thought must have been, listen, if this can work there, maybe it can work for us. Here is the evidence. So what then happened is a record of the meeting. So here we have in May 2021, remember this is when they started to surge, the end of May going into July. They then brought this expert and a whole committee together to discuss alternative approaches because they realized that they had about 7,000 villages that were dispersed due to geography, and they only had 100 ICU beds, 800 oxygen supported beds across the whole region. They definitely needed a strategy that would work. What then happened is that he went into that region, he explained what he did. So the doctors in the intensive care started doing that, and within a few days, they saw the remarkable outcomes of what he had done. It was not complicated, simply a very strategic timing as to what he did in terms of preventing death, reducing the numbers. So, what they then did is that in a few months, they then reached back out to him and said, listen, this is working. Can you train our other doctors who are rurally based to try and impact on saving lives? So this is what then happened. And so you can see here, I'm just going through the full documentation. He broke it right down. So they looked at who can do things. Senior nurses, junior doctors can administer treatment. There was no need for specialists early on in the illness. 5 out of 100 would need hospitalization. So they worked it out that was unique for this part of the world. They went through a question and answer session, looking through everything, trying to find a solution. They identified this remarkable medication was very important that, again, you can't speak about. This is why I say this is clearly not about health. And they went to work to try and see if they could make a difference with regards to it. This was at a very senior level. This was at the Health and Family Welfare Department, the government level, to make sure that they found a strategy that would help their people. They clearly were saving the lives of their people. So, what were the outcomes? And this is the point that I make to people. Keep on talking about, well, the evidence says this, the evidence in a paper says that. I want hardcore, real world evidence that what you are saying works. If I don't see that occurring in the real world, then that's just a paper. I don't know who was bought. I don't know who was paid for. I don't know what the reviewers were. If it doesn't fit, it doesn't count. That's my rule. So, what then happened? And we go back here to, as I said, just in case anybody is trying to get rid of the information, I've got it downloaded. Here we have, this is now what happened, as I said, in June 2021. That was the surge of deaths: 762, 918, 1299. This is August. This is about when he started to be pulled in to train the doctors in the rural areas of this region. And you can see what happened then. So deaths were still occurring, 1299. By September, it was 1400. This had slowed down. Then as you go down, you can see here now, suddenly, October to December, they only had 50 deaths. That's when they instituted the protocol. That's the number. That's real world evidence. And as you go down, 1483, only 30 more deaths. They roll down, and you can see here that all the way 1586, this is now by the end of March. So they're not even bothering to count monthly now, because this had made such an impact in terms of saving lives. Now, listen, as I said, very few people know about this. And this doctor doesn't blow the trumpet, but I knew this was a very important piece of information because this is hidden. Can you believe that a doctor who delivered that kind of information and made that kind of difference in a whole governmental region is then being put on trial for the fact that he did that kind of work? Listen, I keep warning people. If you accept that approach, then you are going to be caught in this illusion that I again got censored when I put that up. It was immediately put a restriction on it. How dare I ask a question, even when this was published in the newspaper factually? You're not allowed to even raise the awareness of this event that happened. I can't even say it now because it will probably get censored. This is not medicine. This is not science. The people who are genuinely going about saving lives are currently being censored. They are currently being hidden, and it is not in a good way. The final point that I'll make is that this region definitely needed this, because this paper has just recently come out understanding COVID-19 vaccine hesitancy in this region, Meghalaya of India. So they went in, and this was only published in February 2024, and they were trying to understand why was it that this region was so hesitant about these vaccines. Well, probably because they had resolved the problem. They had solved it with early treatment. This word that you cannot say, they had solved it with early treatment. Now, I'm going to show you finally at the end of this paper, and the link is in the description. I'm going to show you the kinds of questions that they were asking and they were thinking about. So here is the questions. So don't know is in yellow. No means blue. Gray is not applicable, and brown is yes. Okay, so I'll come back to that. I'll just adjust it so that he can read the questions, and you can then make judge for yourself whether or not they were this is correct. So here we go. These are the questions that they were asking them. Do you think? Not so serious. So the word is not important. Think I have developed immunity. So brown is yes, blue is no, and yellow is don't know. You can see here that generally across the board, and this is not this is across healthcare workers as well, they clearly had views that they were concerned about the safety. A few had fear of pain and needles. Quite a few were worried about the side effects. They had seen messages on WhatsApp and others that caused concern. you know they currently have trustworthy sources. They thought they had trustworthy sources. They were confused by different messages from different sources, so they were very hesitant. Look at this one. They were worried that may cause infertility and impotence. Goodness gracious, how did they know this kind of stuff? That's really the question. So you can see that they had hesitancy. They weren't going to take a significant amount of it. So they would have not had significant protection without some kind of intervention. So one doctor steps into that world, makes a difference, and he is now being challenged for it. What a world we are living in. So, yes, today is a day where even though he is currently in court and facing off the questions, that's what's happening, and you can follow it on Twitter, he is standing proud that he knows that the work and the research that he did at that time saves countless lives, not just where he lives, but across the world, not just in Meghalaya, but also in Malaysia. And many people saw what he did, and it made a difference to what their practice was. So today, we give thanks to true experts, those who are actually practicing, looking out for the lives of their patients, who are making a difference and making sure that they give us a chance to fight another day. Thank you very much for joining me, and let's support him in whatever way we can. Have a great evening.